Hi everyone, it's time again. It's our third monthly web series, October edition. And today, you guessed it right, we're going to talk about X-ray. We're going to talk about X-ray machine. We're going to talk about the history of X-ray, who cannot have X-ray studies, and the body parts that usually are ordered for the X-ray. And we're going to demonstrate our machine and give you or show you some accessories that go with the X-ray studies. And with all that said, we're actually going to start with the history, and Andre was going to educate us about how it all started.
Hi everybody. I'm going to give you a little short brief history as to when X-ray was actually discovered. This was back in 1895 by a German scientist named William Röntgen. Back in 1895, he started doing the procedure to form X-rays for medical use. And it's very funny as to how the first image was created. His wife happened to be in the room while he was doing the experiment, and the famous story. As she's reaching across the table to clean the table, her hand gets on the way of the X-ray beam, and hence the image appears on the other side. So this expedites the discovery process so much, and shortly after that, they start using X-rays for medical purposes. So as you can see, the first ever picture was by accident, and it was of the scientist's wife's hand.
That's second that changed history, huh?
Absolutely, history-changing moment for sure. Yeah. X-ray is, I'm going to have Rubik explain the negative aspect as to which patients can't have X-rays.
As we all know, there's radiation when you do the X-ray. So the only category of people that cannot have X-rays are pregnant women. But even in that case, there's this little factor that risk versus reward. If the mother's life is at risk and reward is going to be greater than the risk, your doctor will always want it, even though the patient is pregnant, even though there is a baby in the womb. If the mother's life is in jeopardy and the X-ray is the only tool that you can diagnose, the doctor will order the X-ray. Very important for safety, because I mentioned radiation. It's very important for safety, and maybe we can talk about the safety now. The aspects of it, what steps we can take.
Of course, what's the most common question that we get patients ask us? How much radiation am I getting by this one study? How many more can I have before it's unsafe? I was thinking about this, and to make this very clear cut and so people can understand, basically a patient can have about 10 chest X-rays throughout the year, which will be considered as safe. Now that this is taking into consideration chest X-rays, we do it in 2 views. So to break this down into other body parts, you can have up to 10 chest X-rays a year. When it comes to the spine requires a lot more views than the chest X-ray. Hence, you can probably only have about 5 to 6 spine X-rays a year.
Because it's 3 views mainly. The
3 to 6 it can go up to, exactly.
Obliques
and the other part are the joints, right? The knee, the shoulder, and those anywhere from 3 to 5 views. So you're looking at about 6 to 8 X-rays a year. So when you come to about 5 X-rays a year, I would definitely bring it up to your referring physician that you've already had 5 within 1 calendar year, so they can be more precautious.
Most probably, knowing the technology nowadays, most probably it's going to be okay, but it's always good and it's always right to consult your doctor and tell him how many you had already.
Absolutely, absolutely. Now that you are in the room, what are some
precautions
that we do to make sure that the patients don't receive radiation and we minimize as much as possible?
Those things are actually called shielding. It's called, the process itself is called shielding, and we use different types of shields for different kind of studies and different kind of body parts. For example, if we do a chest X-ray, it's an apron that we call. It's an apron shield. I'm going to show it to you guys. It's actually this. We just put it, we wrap it around the patient, and it covers the gonads.
Which is the most important thing to cover, yeah.
Exactly. And if we're doing joints, For the joints, we can have the patient just wear this apron, which is a full body cover. Just
hands and legs stick out.
Chest, only hands and feet are sticking out. So if you're X-raying those parts, then we use that shield. And we got the thyroid shield. If you're scanning, I would say maybe abdomen down. Yeah. We always cover the patient. Cover the thyroids. And for kids, just the gonad area, we use this. It's very important to, even though Andre said that you can have 5, 6 X-rays, but it's very important even for those 5, 6, or 8 X-rays, cover the body parts that don't need to be exposed to radiation.
You want to minimize radiation as much as possible, whatever is in our hands, and we're very strong about that.
Yeah. There's always thing what body parts, what X-ray is good for, what body parts we can X-ray, and what results we will get.
With the growth of technology, with MRI, CAT scan, and ultrasound being around, X-ray still holds its strong place as a baseline diagnostic tool. Some of the studies that we see on a normal daily basis are, of course, the chest X-ray. You look for nodules, you look for pneumonia, you look for air in the lungs.
Pre-op, before surgeries, you always do X-ray.
Absolutely.
For cardiac size.
Exactly. Look at the size of the heart. Yes. And then after that, of course, the spine, then the cervical, the mid-back, or the lower back, especially immediately after a trauma. What it does is you want to check to see if there's any fractures, microfractures, dislocations, and also without the trauma, arthritis is best seen on X-ray. So when your doctor orders an X-ray, don't automatically say, oh, why don't I have an MRI and a CT? Because there's certain things an X-ray shows that an MRI is not great at.
X-ray is the base of it. It's a base scan of it.
A lot of the time it's great to do a combination of both, doing an X-ray and a CT. So as you can see in the images, this is what a chest X-ray looks like. And there's a picture of the spine, and also here's a picture of the knee joint. These are what they look like when we do X-rays.
And when we do the joints, actually for the joints, it's like you said, arthritis is the only time that we do joints is if they want to rule out fracture and or arthritis. It's shown. I mean, dislocation. Exactly. It's very it's a very accurate tool for those kind of diagnoses.
Speaking on that, we've heard so many times, we mentioned they did the wrong side, instead of the right, instead of the left.
Yeah.
What are precautions that we make to make sure that, first we're X-raying the correct limb and the correct side, and because there's the technologist who's doing the study, the doctor has to rely on his technique to make sure that annotated right and left. So
it could be a crucial mistake. It could be a very crucial mistake if the sides are not marked correctly. And those are the markers that we use: R for right and L for left.
These are very basically, they come off and they can put it at any area. It's going to be next to the area that if it's an elbow, then it's going to be right next to the elbow, saying if it's a left or a right. Both sides are equally the same, so we need to make sure that we distinguish what's left, what's right, so radiologists can do the proper reading.
And finally, our machine.
Yes, we wanted to show you a little bit about, we're using an X-ray machine system that's called DR system. We've gone from, in the very beginning, from using dark rooms. We would take one shot, take it into the process room, develop it and bring it out. Unfortunately, I'm that old that I've gone through that process, as well. And then from that, we came as what's called the daylight processing, which means you still had films.
A little faster, a little better.
A lot better than a dark room, right? Daylight processes where, we shoot the X-ray and we take that X-ray into the day area, light area, and we put it into the machine, and the image was developed. The very latest technology that we're using, and we were fortunate enough when we purchased this X-ray machine, we were one of the first ones in Southern California. So the company actually used us as a showcase center.
Yeah.
So
after we set up the room, after we were done, the company that we bought it from, they came and saw it and just loved the setup of it. and they use.
So what are some of the advantages that that this room has? We have the capability of doing a conventional laying down, where we have a table we can bring in here, but every X-ray machine has two components. The X-ray tube itself, this is the X-ray tube that produces the X-ray. Basically, you shoot the X-ray in whichever direction you want, and standing behind of the patient is the processor that receives the X-ray. This DR system eliminates the need for film, eliminates the need for a processor. So
and that's very quick, and literally
how long is it? About under a minute?
It's much faster than
faster
that. Actually,
than
it's
that.
about 15
Amazing.
seconds. You get an image rather than processing the films and taking 20 minutes, 30 minutes, having the patient wait to see if that image that you took is accurate or not.
Right.
Literally about 15 seconds, it just comes on the screen. We know if we got it right, and it just
Absolutely.
move on. It makes everything easier for us and for the patients, and more accurate.
At the same time, another important thing is it diminishes the need for repeat X-rays.
Yeah, exactly.
Let's say you don't like a certain area that is too dark or is too light. We have the ability to do post-processing.
Minimizes radiation. That's the most important thing.
Absolutely. Instead of taking another shot with the optimum view,
Yep.
we can go to the old picture through the computer, through the help of the software, and modify the image to the
Just minimize
radiologist.
it, make it bigger, the view, make the view smaller, and just you don't have to expose the patient again. It's all in your hand.
Absolutely. Another important advantage of this X-ray machine is most of the X-rays are done what's called weight bearing. That means you're standing in your natural state. When you lay down, what happens, your joint and your spine relaxes and everything goes back to kind of normal. But when you're standing up, that's when you feel the pressure on your knee. That's when you feel the pressure on your lower back. So it's a lot easier to see misalignments and to see narrowing of the joints.
And let's not forget about the patients that are on wheelchair, they cannot stand. This has the ability to move any way possible
Right.
for us, and the patient doesn't have to stand up from the wheelchair. We just, bring this down, move this around,
Right.
different angles, and you have your picture. You have
Just
your
to
shot.
demonstrate real quickly, let's say we're doing a hand from this process. This can turn horizontal. If you would, Rubik, could demonstrate it here.
Yep. I would just go.
See, this becomes a over-the-top X-ray now.
And of course with the shield on.
Now we can do the hand,
Very easy, elbow.
all type of joints. Same, this goes over, we can bring it down to the foot area.
Exactly. Lower it.
And let's say some people have casts or they're in a wheelchair, they can't elevate or whatever. See, this tilts up and down, so we can
Just kind of hang the foot. Right
we don't
there.
have to move
Yep.
the patient so much as we move the target here.
It's all basically made for to be easy on the patients, especially when the patients when they come here, they have some of them, most of them, they have
Right.
trauma already. So it's just make it easy on all of them. All
And it's
patients,
extremely quick, guys. We can do like the whole spine, which is the neck, mid back, and lower back within 15 minutes.
absolutely.
So that's why a lot of times we take walk-in X-rays on top of having the appointment ones, is we couldn't get through them so fast. Well,
I think, sorry you took it was a little longer, but we had so much information that we want to share with you guys. And, we're always glad to, educate you guys and teach you. And, at the same time, we want to learn
your
from you
comments
guys.
also.
Exactly. We want to learn what do you guys want to see, what do you guys want to hear, what interests you the most, and we'll find a subject and we'll talk about it.
and also tell us about your experience. Did you have an X-ray within the last year? How was it performed? What did you like and did not like about it? So just remember, you can have about 10 X-rays a year. That's going to be safe. Anything over that, you may want to talk to your doctor to maybe use another method that's possible. I don't know if it's an ultrasound or an MRI, which doesn't use radiation. So the number one concern is to make sure that we keep the radiation as low as possible, at the same time obtaining quality of images that would be diagnostic and would provide a accurate report.
Which is the most important, and that's the reason that you come for an X-ray, to get accurate diagnosis.
Well, thank you, everybody. It's the
Thank
topic
you.
of X-ray. Hope we were able to touch a few points that would be useful. God forbid you may need X-rays, but now that you know when you're going in, what to expect and so on.
Thank you for watching. Stay healthy.
See you guys next month. Thank you.